The Ogun State government, through the Ministry of Environment, is scheduled to start the verification process of the producers of table water and beverages in that state. Now, this comes as part of efforts to contain the cholera outbreak that has killed at least 12 people in some areas of that state. During a stakeholder meeting with the Table Water and Beverages Producers Association of Nigeria, Ola Oreshonya, the Commissioner for Environment, revealed that in order to prevent health risks that could impact people's lives and well-being, it became necessary to monitor the hygienic process of producing water products and make sure they meet the necessary standards for human consumption. Well, joining me right here in the studio to discuss this is a team lead, New Central Health Desk, Dr. Kelechi Okoro. Kelechi, it's good to have you join us tonight.
For having me.
Right, we're talking about cholera and interesting developments right there in Ogun State. What are the likely causes of a cholera outbreak?
Okay, so primarily, the cause of cholera is a bacteria called Vibrio cholera, right? And it's gotten from contaminated water, most especially, and food. And aside that, you can get cholera through, where they are overcrowding. Of course, when people are together and there's not a lot of space between them, it's easy to transmit infection from one person to another. Also, there's the issue of eating of uncooked food, poorly cooked food, and then poor hygiene. Very important. A lot of people do not have good hygiene. During the COVID era, that's when we started talking about hand washing. COVID is gone, and then we have stopped washing our hands. Okay, so improper hand washing, and of course, and there's something that usually happens. We eat a lot of swallow and we eat a lot of food with our hands, but we prioritize washing our hands after eating with soap and water. However, you're supposed to do that before eating. Okay, let's also talk about open defecation. In 2023, we still have a lot of open defecation in our country, especially around some slums and urban areas. So when there's open defecation and during this period there's flooding, there's a lot of rain, so it carries the defecation or it carries the feces and spreads it across all water sources and contaminates them. So those are a few of the reasons why you can get cholera. And also, let's talk about malnutrition. Of course, if you're malnourished, you will not be able, your body is not able to fight infections properly. So people who are malnourished can also easily get cholera. Yeah.
Interesting, Kelechi. With respect to the water producers in Ogun State, whom we just talked about, what measures can be taken to ensure that this disease is contained?
Okay, I like the fact that they are putting some premium on the water producers. But let's remember that it's not everybody, or it's not all the time that you depend on, sachet water or bottled water, right? So we'll also talk about what you do as a person, your hygiene as a person in your home, and the kind of water that you take. So considering the water producing companies, I would say that NAFDAC has a lot to do, because we know, and they also know that there are rules and regulations guiding water production, right? It has to be in a sanitary environment. The water has to be treated frequently and monitored, okay, making sure that the water is convenient and safe for drinking. But we know how business people can be. Even when the environment is not sanitary, they still want to make money, so they keep on producing water in an unsanitary environment. So the onus is on NAFDAC and other agencies, the monitoring agencies, to enforce production of safe water for our people.
Right. In producing or purchasing, sachet or bottled water, what do consumers need to look out for? Is it a foregone conclusion that we'd have no protection? Is there something that consumers can do?
Okay, yeah. So beyond what the government should do and the agencies, as a human being, personally, you need to take your own health seriously. So when you're purchasing water, look out for imitations, look out for products that that are not safe. I mean, there are ways you can know that the bottle is budged. It seems that it's not properly covered for the sachet waters and the bottled waters. Check for NAFDAC registration number. Check for you know, all of that. It's something that you should do for yourself and make sure that the water you're consuming is safe. Beyond that, I would like to add this, not everybody takes bottled water or sachet water and all of that. So in your own home, be responsible for the kind of water you drink because you don't know the source of the water. So make sure you boil your water and cool before drinking. At least you are sure that this is a process that you were, you know, primarily involved in, and then you know that that water is safe for you. So boil, cool, and make sure that you and your household are having the best and the safest water for your cooking and for your drinking. Thank you.
Maybe we go back to the days where Nigerians were boiling their tap water to drink
Honestly,
and probably using filters to,
yeah,
you know,
that's
we have
safer
filters
because
at home.
you're part of the process. Yeah.
Right. Kelechi Okoro, thank you so much for your time. She is a medical doctor, but more importantly, she's a team leader of the New Central's Health Desk. It's been a pleasure having you.
Thank you for having me, and make sure and always remember that your health and happiness is my concern.
Right.